My name is Lisa Peterson, and I am going to be doing the presentation for Group 5 today. So we decided to go with an emergency room wait time reduction. We started our project off by doing the weighted scoring model. Our entire group is consisted of healthcare administration majors, and so we felt like choosing projects that would relate to our future careers would be something that would be fun to look into. So here you can see the emergency room improvement plan, which down here beat the other project ideas, not by much, but we all really liked this idea and felt like we could find the information that we needed to on it. Here we have a chart with the average emergency department wait times based on the urgency of the patient care. As you can see, 2% of the visits are immediate and the time is lower versus 41% of them being urgent and the wait time is longer. We decided to take on the task of finding ways to reduce the wait time in emergency rooms in order to improve patient satisfaction and care, as well as helping out the providers of the clinic. The thing with this project that will make it interesting is because we are healthcare administration majors, our project is going to be more of a thorough report and research project rather than actually creating something. For the need and opportunity, we have another chart over here that gives us the wait times in the ERs around the United States. And if you look over here, you can see that Maryland, Maine, Delaware, all of the bigger, higher populated cities, I believe New York is right here, they have higher wait times. And as you come down, they get smaller. Over here to the end of Colorado, Montana, and Idaho is in here, over here. And they're more of a rural area. And so that's something that we'll discuss in one of the next slides. We feel that there's a significant need to find ways to reduce these wait times all over the country. And if we can come up with a plan that can be implemented in an ER to reduce the wait times, we feel that this would not only increase the revenues for the facilities, but it will also improve the patient experience at the ER. The average wait time for all of these combined is around 30 minutes. For the scope of our project, you can see in this flow chart, we started with our idea, decided the functionality of it, and are now going to be gathering data in different areas that we feel will help decrease the wait times. The first one we want to look at is the registration that's offered through the facilities. This means, do they offer online scheduling? Are patients able to get online ahead of time, fill out all the registration paperwork that they need to, so that when they show up to the ER with non-life-threatening illnesses, obviously, that their wait time will be decreased because they've already covered one of the steps in getting the registration done. So we're looking to see if hospitals offer this, if it helps the wait time, if they feel like it decreases it, what methods they do with it, and just different things like that. Another thing we want to look at over here is the doctor-to-patient ratios, meaning the facilities that have higher patients to than doctors that have to see more patients. Does that affect their wait time? Rather than facilities that have less patients to doctors. Now, if you think of that common sense wise, you'll say, obviously, if there's more patients to the doctor, then yeah, the wait time is going to be longer. But that will bring us to our next thing we want to talk about, which is the efficiency system. Now, in the ERs, the thing that makes it a little different for this project also is that you cannot plan for emergencies. And that's one of the things that affects the waiting time for non-life-threatening patients, is that you never know when someone is going to come in that needs to go in ahead of you. So there's systems that can be set in place. An example of this is the SORT, which stands for See, Order, Treat. And it's a program that utilizes providers so that they can examine the patient in triage shortly after their arrival to the ER. Triage is just an area where they decide which level of care the patient's going to need and how much time that's going to take. So with this, we're looking to see if there are different systems that hospitals have that they put into play as an emergency comes in, or if their ER gets suddenly busy, if there's different things that they do to keep the wait time from getting completely outrageous. So that's something that we're interested in looking into. The other one has to deal with the slide that we talked about before in the location. We want to know if city versus rural influences the wait times, or if it's the fact that maybe the rural settings have different plans that they implement and that's why they have the lower wait times, or if it's just because it's lower amount of people. And we want to know how this can be managed depending on what we find out. Is there ways that we can decrease the city based on plans that we can implement and changes that we can make, or is it just going to be too overpopulated? For the time and cost and feasibility of this project, if you look at our Gantt chart here, you'll see that we have the time set up so that it is in consistence with what our semester weeks are lined up with. So this is when we started the first step of the project, and these are the different phases that we'll be going through with this project, and this is when the project will end, which is in the 8th week of the semester. It will require several hours a week of research and communication from each team member, as well as with any hospital staff that we were able to gather information from. For the cost, we don't anticipate too much because it is more of research and reporting. The only cost that we can think of that might incur is a minimal amount due to fuel usage if we are allowed to go visit an ER so that we can gain up close information. Feasibility, because we are healthcare administrators, we feel that our team has the capability of reaching out to different emergency departments in different states and being able to find out how each of them functions in the different situations that we have discussed. This diversity information will allow us to come up with an overall plan of action that will hopefully decrease the waiting times. The qualities, risks, and resources. These are just a few of the hospitals that we're interested in looking into. They're in the same state, but they're different populated areas, so it'll be interesting to see what we gather from them. We define success with this project is if we're able to come up with a plan of at least 3 to 4 steps, which we've mentioned before, that we can easily implement and realistically implement into an ER facility, and then see if those will improve the current time of the of the ER waiting room. Some of the risks, because this project is research, is that we won't be able to access the information that we're wanting to from the hospitals, or that they're going to give us too much information and it'll be a broad subject and we'll have to narrow it down, and this can be difficult with the limited amount of time that we have. And then not being able to communicate the vision of this project effectively because there are different majors in this class and we see things differently. So I'm hoping that you'll understand what we're trying to get to here. The resources that will be required for this project are going to be the 4 team members that are working on it, as well as the local hospitals that we choose to interview and look into. Our computers and databases with books and or articles, whatever we need to find that will help us research, support, and figure out our project. And communication websites such as Google Hangouts will also be really beneficial so we can keep in touch. This project we're really excited about looking into because it's something that we might possibly be doing in the future. We never know. So hopefully you guys can see the idea behind it that we're trying to put forth, and that we'll be able to complete it the way that we're wanting to.